If you broke a bone 40,000 years ago, you probably assume that was it. No hospital, no x-ray, no antibiotics. Just a slow, painful death from infection, or from an injury that never healed right and left you unable to keep up with the group. That assumption is wrong, and the evidence for exactly how wrong it is has been sitting in caves and burial sites for tens of thousands of years. We found a skeleton whose leg was surgically amputated 31,000 years ago, and who lived for years afterward. We found a Neanderthal who survived a crushed eye socket, a withered arm, and a limp decades before he finally died of old age. We found thousands of ancient skulls with a hole deliberately cut into them, and most of those patients didn't just survive the surgery. They went on living long enough for the bone to heal back over. None of this was luck. It was medicine. Crude, dangerous, sometimes fatal medicine, but medicine with real anatomical knowledge, real infection control, and real pain management, going back tens of thousands of years before anyone wrote a word down. So how did people with no germ theory, no metal scalpels, and no anesthesia as we'd recognize it, keep each other alive through wounds that should have killed them? That's what we're going to walk through, from the oldest surgery ever found, to a skull operation that outperformed 19th century battlefield medicine, to a wound closing trick involving live ants. Before we get into what ancient people did, it's worth being clear about what they were up against, because the danger was never really the break or the cut itself. A broken bone that heals crooked is a serious problem for a forager who needs to walk long distances, climb, and carry weight. A badly set leg could mean a lifetime of reduced mobility in a world with no wheelchairs, no accommodations, and no light duty. A deep wound is a serious problem for a completely different reason. Blood loss can kill in minutes, and even a survivable wound becomes a death sentence a few days later if it gets infected, because there was no way to know that invisible organisms were the cause, only that wounds that looked a certain way, hot, swollen, weeping, usually ended badly. So any workable system of ancient trauma care had to solve three separate problems at once: stop the bleeding, immobilize and align the injury so it could heal in a usable position, and somehow keep the wound clean enough that it didn't turn fatal. Every technique we're about to look at was ultimately in service of one or more of those three goals, usually without anyone involved having a word for infection, bacteria, or blood vessel. And there was no separate category of doctor to hand this problem to. In a small forager band, whoever had seen the most injuries and remembered which responses worked and which didn't effectively became the group's medical knowledge base, a role passed on the same way tool-making or fire starting was passed on, by watching, doing, and being corrected. Every technique that spread and survived across generations had to actually work often enough to be worth repeating. The ones that didn't simply vanished along with the people who tried them, leaving no evidence behind at all. What we're looking at in the archaeological record, then, is already a survivorship story. We only see the methods that succeeded often enough to become tradition. In 2022, researchers led by archaeologist Tim Maloney published a discovery from a cave called Liang Tebo on the Indonesian island of Borneo that rewrote the timeline of surgical medicine entirely. Buried in the cave was a skeleton of a young person, roughly 19 or 20 years old at death. Their lower left leg was missing, not from an accident, not from an animal attack, but from a clean, angled cut through the bone, made during childhood. There was no sign of a crushing injury, no bite marks, nothing consistent with the leg being torn off. The bone had been deliberately surgically removed. And here's the detail that matters most. The remaining bone had healed and remodeled over the amputation site, with the kind of thinning you'd expect from years of disuse. This person didn't die on the operating table. They lived for an estimated 6 to 9 years afterward, growing into early adulthood with one leg. That skeleton is now the oldest known evidence of a deliberate surgical amputation on Earth, at roughly 31,000 years old, beating the previous record holder, a 7,000-year-old Neolithic farmer from France, by about 24,000 years. Think about what that surgery actually required. With no metal tools and no written anatomy textbook, whoever performed it had to know enough about the leg's blood vessels to cut without the patient bleeding to death in minutes. They had to control a wound that size well enough to prevent a fatal infection in a rainforest environment that is about as hostile to open wounds as it gets: tropical, humid, thick with the exact bacteria that turn an open wound fatal within days. And they had to manage a child through unbearable pain using nothing we would recognize as anesthesia. This wasn't an accident that happened to work out. This was applied medical knowledge, tens of thousands of years before agriculture, before cities, before writing. It also means the surgeon, whoever they were, had almost certainly done something like this before. A first attempt at an amputation, performed by someone with no prior experience, is far more likely to end in the patient bleeding out on the spot than in 6 to 9 more years of life. A success at this level implies a working technique that had already been tested, refined, and possibly passed down, meaning this Borneo case probably isn't evidence of the first amputation ever attempted by anyone, anywhere. It's evidence of the oldest one that happened to survive for archaeologists to find. Long before that Borneo discovery, archaeologists had already found evidence that ancient care for the badly injured wasn't unique to our own species. In 1957, archaeologist Ralph Solecki excavated a Neanderthal skeleton at Shanidar Cave in what's now Iraqi Kurdistan, given the name Shanidar I. This individual died somewhere between his mid-30s and mid-40s, old age by Neanderthal standards, but his skeleton reads like a catalog of trauma. A crushing blow had damaged his left eye socket badly enough that he was likely blind on that side. His right arm was withered and underdeveloped compared to his left, consistent with a partial loss of the forearm or hand, possibly from childhood. A healed fracture in his right foot likely left him with a pronounced limp. Every one of those injuries shows clear signs of healing. None of them killed him. He lived with all of them, probably for decades, blind in one eye, missing the use of an arm, and limping, in an Ice Age environment that offered zero tolerance for weakness. There's genuine scientific debate about exactly how much deliberate nursing care this implies versus how resilient a wounded body can be on its own. That's a real and ongoing conversation among researchers. But the baseline fact isn't in dispute. A Neanderthal with this level of disability could not have hunted effectively, and very likely could not have survived for decades without his group sharing food and protection with him. Whatever you want to call it, that's a form of medicine. Even if the entire treatment was just, don't leave him behind. Surviving a break was only step one. The bone still had to heal in a position where the limb actually worked afterward, and that required deliberately restricting movement for weeks, which meant inventing the splint. Some of the clearest physical evidence for this comes from ancient Egypt. Excavations by the anatomist Grafton Elliott Smith, documented in later medical histories, uncovered roughly 5,000-year-old Egyptian remains with fractured bones that had been splinted using strips of bark, wrapped in linen bandages, and held firmly in place. A design that, mechanically, isn't so different from a modern splint. Egypt's dry climate preserved some of these dressings well enough that traces of blood were still visible on the linen, thousands of years later. For open fractures, the kind where the bone had broken skin, which is far more dangerous because of infection risk, Egyptian practitioners packed the wound itself with plant fiber dressing before splinting over it, an early intuitive form of wound packing that we still use a version of today. None of this required understanding bone biology the way we do now. It required something simpler but no less important: careful, repeated observation that a broken limb held still in the right position eventually became usable again, and one held in the wrong position, or left to move, usually didn't. Of every ancient surgical practice, the strangest to modern eyes is probably trepanation, deliberately cutting or scraping a hole into a living person's skull. It sounds like it should be a death sentence almost every time. The evidence says otherwise. Trepanning skulls have been found across an enormous range of ancient cultures. Neolithic Europe, and especially pre-Columbian Peru, which alone accounts for more trepanning skulls than the rest of the world combined, with well over 800 examples documented. On many of these skulls, the bone around the hole shows smooth, rounded regrowth, direct physical proof that the patient's body kept living and healing long after the surgery. A 2018 study by neurologist Daniel Kushner, bioarchaeologist John Verano, and their colleagues tracked how survival rates for Peruvian trepanation changed over roughly 2,000 years. In the earliest samples studied, from around 400 to 200 BCE, survival was close to 40%. By 1000 to 1400 CE, it had climbed to around 53%. By the height of the Inca period, between 1400 and 1500 CE, survival rates on the skulls examined ranged from 75 to as high as 83%. For comparison, battlefield cranial surgery during the American Civil War, more than 300 years later, and performed with a modern understanding of anatomy, carried a mortality rate of 46 to 56%, meaning, by some measures, Inca surgeons were outperforming Civil War surgeons at the exact same procedure. The explanation isn't mysticism, it's iteration. Centuries of surgeons refining the technique, learning to keep the opening small, learning where the skull could be safely cut without damaging the membrane underneath, learning how to control bleeding, passed down, tested and improved, one patient at a time, long before anyone had a word for surgical technique. The tools themselves were simple: blades of sharpened obsidian or flint, sometimes a scraping tool used to slowly grind through the bone in a controlled groove rather than cutting straight through it, which is a slower method but a much safer one. And trepanation wasn't performed only after head injuries. Many trepan skulls show no sign of prior trauma at all, suggesting the surgery was also used to treat problems we'd now recognize as seizures, severe headaches, or other neurological symptoms with no visible external cause, on the theory that releasing pressure, or whatever was believed to be trapped inside the skull, could relieve them. Setting a bone or closing a wound only mattered if the injury didn't turn septic afterward, and this is where ancient medicine gets genuinely strange, because in a few specific cases, it was accidentally right for reasons nobody involved understood. Egyptian medical texts, including the Edwin Smith Papyrus and the Ebers Papyrus, describe dressing wounds daily with a mixture of grease, lint, and honey, continued until he recovers. We now know honey is genuinely antibacterial. Its low water content pulls moisture out of bacteria, its natural acidity is hostile to microbial growth, and it slowly produces hydrogen peroxide as it breaks down. None of that was known in ancient Egypt. What was known, through pure repeated observation, was that wounds dressed this way tended to do better than wounds that weren't. The Ebers Papyrus goes further, listing roughly a dozen separate remedies that call for applying moldy bread directly to an infected wound. That detail sounds almost like a coincidence, until you connect it to the fact that bread mold is very often a species of Penicillium, the same genus of mold that, thousands of years later, produced the compound Alexander Fleming identified in 1928 as penicillin, the first true antibiotic. Ancient Egyptian healers weren't practicing microbiology. They were running an unknowing multi-century clinical trial, and the results told them moldy bread worked on certain wounds, so they kept using it. Closing a wound outright, rather than just dressing it, is documented at least as far back as the Edwin Smith Papyrus, which describes stitching lip, throat, and shoulder wounds shut. The most striking ancient suturing technique, though, comes from India, from a surgical text called the Sushruta Samhita, attributed to the physician Sushruta, and likely compiled sometime around the middle of the first millennium BCE. For closing certain wounds, particularly in the abdomen, the text describes a method using the mandibles of large ants, pressing the ant against the two edges of the wound until it instinctively bites down and clamps them together, then twisting off the body, leaving the jaws locked in place like a living staple. It sounds improvised. It's actually a clever, reproducible piece of applied entomology, and versions of the technique turn up again centuries later in medieval medical writing far from India. Sushruta's text goes well beyond that one trick, describing reconstructive nose surgery using a flap of skin from the cheek or forehead, more than a dozen distinct techniques for repairing damaged ears, and a training method where students practice their cutting and suturing on watermelons and gourds before ever touching a real patient. A rehearsal before reality approach that any modern surgical training program would recognize immediately. Some translations of the text also describe wine given before certain procedures, an early, imprecise attempt at dulling pain and easing anxiety before surgery, centuries before anyone understood anesthesia as a science. Managing pain elsewhere was harder to solve consistently, but not completely unsolved. Willow bark, used in both ancient Egypt and later by Hippocrates in Greece, contains a compound called salicin, the direct chemical ancestor of aspirin, isolated and understood by chemists only in the 1800s. Long before anyone knew why it worked, people had figured out through trial and error that chewing or brewing the bark dulled pain and reduced swelling. And running underneath essentially all of this, the splints, the honey, the ant sutures, the willow bark, is the Edwin Smith Papyrus's real innovation, the thing that makes it matter as much as any individual remedy inside it. Across its 48 documented cases, the text follows patients through a consistent, rational structure. Examine the injury, state a diagnosis, give a prognosis, and only then prescribe treatment. It even includes cases honestly labeled an ailment not to be treated, an acknowledgement, in writing 4,000 years ago, that some injuries were beyond what the medicine of the time could fix. That is the beginning of clinical thinking itself, roughly 2,000 years before Hippocrates. None of this was safe by modern standards. Amputation without real anesthesia, trepanation with a stone or obsidian blade, wound care built on trial and error instead of germ theory. A huge number of people who went through these procedures didn't survive them, and we only ever hear from the bones of the ones who did. But look at what ancient healers were actually doing, stripped of the tools they lacked, identifying infection risk and packing wounds to reduce it, using a substance that was genuinely antibacterial for reasons they had no way to know, refining a dangerous skull surgery over centuries until it outperformed 19th century battlefield medicine. and documenting cases with an honest, structured diagnosis and prognosis method that is recognizably the ancestor of how a doctor still evaluates a patient today. The tools have changed almost beyond recognition. The core logic, observe carefully, test what works, keep what survives, contact with reality, write it down so the next healer doesn't have to start from zero, is the same one still running every hospital on the planet. That thread runs back past the Edwin Smith papyrus, past the Inca trepanners, past Shanidar Cave, all the way to a 19-year-old in a cave in Borneo, 31,000 years ago, who lost a leg as a child and lived anyway.